Hello guys, myself Anubhav Arya, a fifth year medical student at Samaj State Medical University. So basically मेरा आज का नया वीडियो उन स्टूडेंट्स के लिए होगा जो स्टूडेंट्स MBBS अब्रॉड से करना तो चाह रहे हैं या इंडिया से भी करना चाह रहे हैं। ये बेसिकली ये सब सारे बच्चों के लिए है, चाहे वो इन गवर्नमेंट मेडिकल कॉलेज से कर रहे हैं या फिर MBBS कहीं से भी कर रहे हैं, उनके लिए है। जैसे कि USMLE, PLAB, AMC, ये सारे एग्जामिनेशंस जो होते हैं, ठीक है, तो उनमें क्या पैटर्न है, उनमें कैसे हम अप्लाई करते हैं, कितने मतलब पूरी कंप्लीट डिटेल्स, ठीक है, उस यूनिवर्सिटी को लेके। तो हमारी यूनिवर्सिटी सॉरी मतलब उसमें जो अप्लाई करना होता है USMLE प्लैब वगैरह में कैसे कैसे क्या एग्ज़ाम पैटर्न कैसे होता है, तो उस चीज़ को लेके जो है हमारी यूनिवर्सिटी ने और हमारी यूनिवर्सिटी में जो भी हमारी कंपनी है स्टडी पैलेस, तो उन्होंने एक ऑर्गेनाइज़ कराया था मीटिंग, जो कि यूनिवर्सिटी के लिए, नॉट ओनली हमारी यूनिवर्सिटी और भी कुछ यूनिवर्सिटीज़ थे, सारी यूनिवर्सिटीज़ को एक गैदर करके एक ऑनलाइन जूम पे मीटिंग हुई थी, जिसमें हम लोगों को बताया गया कि कैसे कैसे क्या क्या हम लोग कर सकते हैं आगे करियर फ्यूचर गाइडेंस के लिए, फ्यूचर में हम कैसे कैसे ऑप्शंस को रख सकते हैं। आगे कंटिन्यू करते हैं अपने वीडियो को। मैं अब वो क्लिप चलाऊंगा जिसमें जो डॉक्टर हैं वो आपको पूरा एक्सप्लेन करेंगे कि क्या प्रोसीजर है, टोटल प्रोसीजर क्या क्या है। सो स्टे ट्यून्ड, एंड अगर आपने अब तक सब्सक्राइब नहीं किया चैनल तो प्लीज़ सब्सक्राइब करें, वीडियो को लाइक ज़रूर करें।
Even when come back to India after a decade or 2 decades, the degrees which have been recognized are 5 countries, that is US, UK, Australia, New Zealand, Canada. I'm speaking about the post-graduation. So for UK, it is PLAB, which is getting replaced as something called UKMLA from this year, that is 2024. And there are two ways to enter into UK. One is a licensing pathway, that is PLAB or UKMLA, and second are membership examinations. So don't get confused or something. I'll walk you through all the pathways. Don't get confused. And second is the USMLE pathway. Third is Australia, AMC exams. Fourth is Canada, MCCQ and NACAST. And fifth is in New Zealand. These are the 5 countries where you can go. Here we'll be discussing primarily about the 3 countries. You see, international medical graduates constitute about 30% of the physicians of US, UK, Canada, and Australia. That's a staggering number. So when it comes to UK, let's take one examination is PLAB, which is getting replaced by UKMLA, and another is a membership examination. So PLAB is a licensing exam, and MRCP, MRCS, MRCOG, MRCPCH, these are all called as membership examinations. In both ways, you can go through that, go to UK. So I'll initially explain about PLAB. If you explain a bit about PLAB, and it's just the name change and nothing much change with the UKMLA, I'll explain that. So at your level, when it comes to PLAB, PLAB is usually professional and linguistic assessment mode. It's conducted by GMC, the General Medical Council. It has two parts, PLAB 1 and PLAB 2. PLAB 1 examination is basically multiple choice question examination. Earlier it used to be paper-based. Now they made a screen-based examination, that is computer-based. And the second PLAB 2 is basically in clinical stations where you go. See here, PLAB 1 MCQ, 180 questions, 3 hours, single-based answer. PLAB 2 is OSCE, Objective Structured Clinical Evaluation, where there will be 18 stations where you'll be taking history, you'll be communicating, you'll be taking the clinical skills, and you'll be going through all the stations and you'll be marked. Okay, clinical examination, practical skills, and interpersonal skills. So PLAB 1 examination centers are all metropolitan cities of India and across the world. But PLAB 2 center is only in Manchester, not even in UK. Even in UK, there's only one center that is in Manchester and nothing more. And if you see the pass rates, the students keep asking, what is the success rate? Usually, if you see the stats, around somewhere between 60 to 75% is depending upon the paper and all. Usually, earlier the exam used to be conducted twice a year, but since COVID, it is being conducted 4 times a year. And PLAB 2 pass rate is slightly high because those PLAB 2 is attempted by those people who are successfully cleared PLAB 1. And PLAB 1 examination, it costs closely approximately 240 pounds, and part 2 is around close to 900 pounds. But the recent transition from May 17th, 2024, that is less than 20 days from now, PLAB is officially getting transition to UKMLA, United Kingdom Medical Licensate Assessment. It is United Kingdom Medical license assessment. So this is different from USMLE. USMLE is when USMLE gives you entry into the residency, UKMLA is not giving you entry into the residency. It's a licensing examination. Just like after completing your MBBS there in Russia, if you want to come back and practice in India, you write an FMG examination that gives you a license to come and practice in the country, India. Similarly, this gives you a license to go and practice in UK. That's as simple as that. Okay. It has again two parts: AKT, Applied Knowledge Test, which is a multiple choice question examination. And again, it has two papers with 100 single best answer questions each. And clinical and professional skills assessment, it is similar to your PLAB 2, where again, you will be going through various stations where you will be evaluated. There will be mannequins, there will be patients where you will be assessing. You will go in a cyclical fashion, you complete this. This again happens only in Manchester. This is an online examination. Okay. And the membership examinations like MRCP, if you want to practice medicine, that is internal medicine. MRCS is for surgery. MRCOG if you want to do obstetrics and gynecology. MRCPCH for pediatrics. MRC psychiatry. MRCEM for emergency medicine. FRCA for anesthesia. FRCR for radiology. In this, few things you can do after going through PLAB. You go to PLAB and then you work there at the level of foundation year 1 or 2, depending on whether you have completed your internship or not. And then you can attempt these examinations. Few examinations, you can come back to India, you can complete FMG, and then you can directly complete MRCP or MRC. There are two pathways like which you can enter. But if you ask me which is the easiest at the moment, yes, easiest and earlier is to go to PLAB or UKMLA. But always having a plan B makes us very confident in attempting the PLAB A. So there is like before taking this examination, you have to qualify in the English examination, English proficiency examination. The two proficiencies are IELTS versus OET. When compared with IELTS and OET, OET is only for healthcare professionals like doctors, nurses, physiotherapists, pharmacists, and so you need to get a B grade here. Here you need to get 7.5 score. If your IELTS band 7.5 score should be there in each domain of listening, reading, writing, and speaking. Okay. So if you ask me, what is the pathway? So if you're preparing for PLAB or UKMLA pathway, the sequence will be: first you complete your IELTS or OET examination, then create a GMC account. Once you create a GMC account, you have to book slot for PLAB 1 or UKMLA 1. This is an MCQ examination. Once you complete this, then you book slot for UKMLA 2. And once you complete this examination, you go for GMC registration. Once GMC registration is done, you can apply for the job. So which level? If you see, so UK system is something like that: FI1, FI2, ST1, ST2, ST3, ST4, 5, 6, 7. So FI1 and FI2 are foundation year 1 and 2. ST or ST1, 2, 3, 4, 5, 6, 7 are like specialty training. So foundation year 1 and 2, if you see, if you don't complete the internship, you enter at this level. If you have completed internship, you can enter at the level of FI2. There's again something called UKFPO, foundation year orientation thing. And then specialty training is where when you decide on medicine, surgery, gynaecology, pediatrics, you enter through this. So in these 3 things, you complete your MRCP or MRCS, MRCOG. And here it may be super specialty basically. Super specialty training. And usually the salaries in UK will start at around 30 to 35,000 pounds per annum. And when it goes to, if you're starting at the level of through the PLAB or UKMLA, when you start at the level of MRCP, MRCS, it's usually around 50,000 pounds per annum. Okay, this is about the UK pathway in brief. Then USMLE, USMLE, most popular United States Medical Licensing Examination. So earlier the exam usually step 1, step 2, CK, CS, and step 3 used to be there. Now From 2020, step 2 has been discontinued. Step 1 examination, basically that's the basic sciences. Step 2 is the clinical sciences, that is medicine, surgery, kind of. And step 3, usually you do during the residency while you're doing there. But now because of the increased competition, like people are preferring to get it done before because many matching programs are also thinking about whether they have completed step 3 or not. So though it is not mandatory, people are doing it. Okay. The most important two changes which happened in 2020 and 2021 are one, step 1, usually the scores, step 1 score, step 2 score. Now they removed the step 1 score. It's only pass or fail for USMLE. Step 1. Okay. And the number of attempts of each step from 6, they decrease it to 4. This is very, very, very important. And from 2021, the CS clinical skills examination, for which you have to go to all the way to US to attempt this examination, just the examination has been removed and it has been replaced, or instead of this, they brought the OET examination, which is just an English examination. So there's the two major changes which happened in the last 3 years. So see here. So before 2022, though they announced in 2020, the 2022 before till January 25th, the scores will be there, and after this only pass or fail for this. Okay, this is how the result will come, despite like how much score you have. And the number of attempts have been decreased. So USMLE results, usually they give a 3-digit scale. Step 1, 194, if you get, you are pass. Step 2 CK 209, though it is pass, because step 2 CK is the most important thing which determines, like among the scores, this is the most important one which determines the score. So we have ideally should aim for 240 plus, along with a good portfolio. So usually the pass percentage is close to 87%, but like it's not about the pass here, it's about the getting into the residency. That's what matters to us, basically. Okay, so which specialty is very important, where the examinations are asked. And remember, pathology is the most important thing, like where almost close to 50% of your step 1 questions comes from pathology. Very, very, very important. Followed by physiology, pharmacology, biochemistry, and all. So this is very, 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 very important. Right now. Okay. So step 1, it is a 1-day examination. Whole day you will take an online examination in prometric centers. It is divided into 7 60-minute blocks. That is, each block will be having like close to 40 to 41 questions, 38 to 40 questions. And number of questions usually vary from session, but will not exceed 40. Usually around 39 to 40 will be there. So the total number of questions should not exceed 280. And in between, you can take 1 hour break. Okay. So that is how this examination has been designed. And step 2 CK is 8 60 minutes blocks will be there. And you take this examination over 9 hours. And here you take predominantly the number of questions here, the overall number of questions should not exceed 318. But see, the medicine takes most of the things. 50 to 60% of the questions are from medicine, followed by surgery, peds, OG, and psychiatry. So first and second year subjects are very important for USMLE step 1. Among this, pathology is the most important subject. So even if you mastered pathology, and even if another 2 subjects, still there are chances of you clearing this examination of USMLE step 1. So it's not and pathology, if you learn from a good teacher, like pathology is one of the most easiest subjects, considering it's all about physiology and pathology interlinking and trying to deal with the molecules and all. It's very, very, very easy thing actually, if you learn with the basics rather than mugging up. Okay. Then medicine, surgery, peds, obstetrics, gynecology, and psychiatry. Okay. Then what are the requirements for step 1 and step 2? What are the requirements? You have to be officially enrolled in a graduate like of US, but for us who are doing it from outside, a medical school outside US and USA should be listed in World Directory of Medical Schools as meeting ECFMG eligibility criteria. That's it. And attempts we discussed, and it happens in almost every prometric center across the world. And what are the fees? Like usually for ECFMG certification, it costs $150, and for step 1 and step 2, it is close to $1,000. And you can extend the eligibility period by paying $90. That is like 3 months. If you want to take, suppose you plan it, okay, I want to take the examination in the month of April to September, and sorry, April to May, and then you can extend it for a while. Okay, then what are the steps? Usually you have to master the steps, step 1 and step 2, ECFMG, register, verifying the medical degree, confirm you passed the steps, After getting ECFMG certification, then apply for the residency. Like getting letter of recommendations is very important. You have to prepare your personal statement, decide which specialty and programs you want to apply, and submit your application through IRAS, electronic residency application system. And then you enter the match, national residency matching programs. Oh, excuse me. And so usually what happens is the sequence. So ECFMG verification. What you can do is USMLE step 1, step 2. Step 1, preferably like either you can take it in 3rd or 4th years. Step 2 during your internship or after that. You can take it like USMLE step 1 after that also. Like that's the thing is you can take even USMLE step 2 first and then step 1. That is also an option. And after this, complete OET, which has a 2 years validity. And then what happens is you submit your application. Usually the last date to submit the applications is mid-September and sometimes till September of 30th. If you submit your applications by September 30th, what they'll do is 15 days, they'll review. And from October till February, the interviews happen. So depending on like which positions you applied, which residency programs you applied. And once you apply in February, the results will usually come in the month of March and you start the residency in July. So if you are targeting for the residency of July 2025, I'm just taking an example. So if you want to take in July 2025, you want to start the residency means the March 2025, the results, they'll announce the results. So October to February 2025 is basically, this is the time where you give the interviews will be there. For this, you have to submit your application by September. When you are submitting the application by then, you have to complete your USMLE step 1, step 2, OET, and a good portfolio. When I say, I'll explain a bit about portfolio also, including research paper presentation, publication, leadership roles, training experience, teaching experience, and all these things. And ideally, you should have done like clerkships. Then, coming to AMC, Australian Medical Council. Australia is again a dreamland for many. Australian Medical Council, you can enter through 2 pathways, competent authority path. In fact, 4 pathways like competent authority, standard pathway, specialist pathway, short term. But again, for us, the important is the standard pathway and competent authority pathway. So what is standard authority? Standard pathway. Standard pathway is simple. You apply for the AMC for standard pathway and you get your primary source verification, that is again similar to WDMS. You just check, and it has 2 examinations: AMC CAT, that is computer adapted test, AMC CAT computer examination, that is MCQ examination, and second step is AMC clinical. Just like how PLAB has 2, these are also 2. And here AMC CAT happens across the prometric centers across the country. AMC clinical happens only in Melbourne, and you pass the AMC examination. There are 2 pathways. AMC examination CAT only passed, and then pass AMC clinical examination, you apply for the job, secure an employment job, and then apply to the Medical Board of Australia for provisional registration. You complete the 12 months of supervisor practice, and then you get a general registration and you can apply for the residency and all. There's another way. If you have a doctor, if you know someone in Australia who is a doctor or who can sponsor you, so what you can do is, by just giving AMC CAT, you can secure an employment offer, they can sponsor you, and you apply to the MBA for limited registration. You can skip rather than initially doing the AMC clinical, here you can do 12 months of supervisor practice. So during the supervisor practice, you can either pass the AMC clinical examination and receive AMC certificate, or in that place, you can even skip the AMC clinical examination and complete workplace-based assessment. That is, the doctor who has sponsored you and the doctors who are there, they can give a workplace assessment. Okay, this doctor is a safe doctor who can do a good supervised practice that can serve. These are the pathway. In the standard pathway, regularly AMC CAT and then clinical and then apply for registration job. And other way is by, if you know someone, like after AMC CAT, directly you can go there and you can do this. And what is a competent authority pathway? Suppose you have done your PLAB examination for UK by working there for 2 years. See, 12 months after doing this, after 12 months of supervisory training plus one year of care. That is, you completed your PLAB and get a GMC registration. And after working 2 years there, without writing AMC examination, you can directly go into Australia. Same with MCCQE, that is Canada. USMLE, after your residence for 2 years, you can directly go there. So these are all the various pathways you can enter into Australia. So as I said, it's a CAT examination, that is AMC MCQ examination is 150 questions. It has 3.5 hour sessions. Medicine 30%, surgery, ops, pediatrics, psychiatry, and population health. That is, it is a preventive and social medicine. Then the beauty of this examination is, except in December and January, the exam happens every month. You can take it at prometric centers across the country. Clinical examination, again, similar to PLAB 2, where you will be having various stations, you will be clinical assessments, and you may be having actual patients, simulated patients, videotaping, and some charts, digital images, photographs like X-rays and all will be there. So history taking examination, all these things will be there. And you have to create your, how to start. You have to create an AMC portfolio, which includes 500 Australian dollars. In additional qualifications, verification and all will be there. But these exams are pretty costly. CAT MCQ examination authorization is close to 2,720 Australian dollars, and clinical examination is 3,530. So this is quite some amount for the examination. And the AMC portfolio, like you can creating Epic account and all, like which we will guide through you. And this are various pathways like standard, competent, specialist pathway, short-term pathways and all, which is, I explained about the standard pathway and competent authority pathway, which are important. Specialist pathways are like, which comes at much higher level. Then comes to portfolios, very, very, very important. Whenever you're going for Western world and abroad examinations, these are very examined. It's not just about the scores, but like how you differentiate yourself. That is, any additional undergraduate degrees or qualifications, any postgraduate degree qualifications, any additional achievements like prizes, honors, any presentations, post research paper presentations, research posters, any publications, any teaching experience. The teaching experience might be for your juniors, might be for the nursing staff, might be for the physiotherapists. Have you got under any training in teaching? What are any quality improvement, leadership and management you have? Any leadership roles you hold? What is your commitment to specialty? Tomorrow you say like, I'm interested in medicine. Like what have you done in the medicine? And any achievements outside the medicine, like training courses attended, like BLS, ACLS, all these things make this is a direct snapshot from the UK portfolio. Okay. So again, reinforcing audits, quality improvement, publications, presentations, leadership management, training, experience in teaching professionals, additional degrees, all these things are very, very important. So there's a difference between audit and quality improvement, which will take you through publications. Again, original reports, original research, case reports, and whether they've been peer reviewed or indexed in PubMed, all these things are important. Presentations, the level of meeting, where you do these presentations, and leadership management, whether it be medical positions, non-medical positions, whether it can be very small, like a class representative, managing rotations in your specialty. It can be, you can be an ambassador for a medical conference, so you're organizing capabilities, voluntary organizations, so all these things matter. The teaching, which I explained, like you might have you might have taught your juniors or nursing or physiotherapists, and any additional degrees like MRCP, MRCS, all these things matter. Commitment to the specialty. So electives as a medical student, your taster weeks, all these things matter. Achievements outside medicine, sports, arts, charity, voluntary work, and technological innovation. Just to add one slide. So if someone says like, okay, I'm from medicine, like here's the career options we have seen in US, UK, and Australia. Anything else we can do rather than being into the clinical medicine? You can do health informatics, medical journalism, and tech into biomedical engineering. When people go to IITs, entrepreneurship, clinical research, MBAs, can be a medical legal advisor. This is the new horizons which are coming up. Okay. So we will share you the feedback form and the questions if you have, you are free to type, and all the very best, guys. Now you feel free to ask any questions, like whatever you feel like. It's open for discussion. no question is silly, like please feel free to ask the questions. So you can type in the chat box or you can unmute yourself and can ask, like it's to you.
Guys, if you have any doubt, please ask in the chat box or just message me or ask us. Sir is ready to answer. Sir, is there anyone we should unmute to next, sir, to talk?
Yeah, Angel, you there? Dr. Sadanand, so in India, like in Indian rupees, how much we can earn after UK doctor? Like to start with, if you go with the PLAB, it starts with 35 lakhs per annum. And if it is with MRCP or MRCS, I'm saying at the moment, like, but if it is after 2 to 3 years, the major change is going to come in UK next year. If you might be aware that last year there's a big strike in NHS after 40 years. There is a strike regarding the pay scale and they are increasing that. There will be slightly. By the time you enter, like in next couple of years, it will be touching around 40 to 45 is where you can start with at least 40 lakhs to start with per annum. What is the right time to start preparation for PLAB or USMLE? See, for any examination, let it be USMLE, Australia, the most important thing is getting the basics strong. And the examination, the concept still remains the same, whether it might be medicine, surgery, or for your university examination or PLAB or FMG examination, the concept still remains the same. So the earliest is how earlier you start, that's the better basically. Okay. Yes, when compared with PLAB or USMLE, which needs more time, USMLE definitely needs more time and it goes more depth when questions. The best time to start was yesterday, and the next best is to start is today. That is, I mean to say that earlier the better. Immediately after like your first MBBS, like start preparing for, like if you're preparing for USMLE, start immediately for that because the pathology is the most important topic. But it is there are people who started their preparation even after the MBBS also, but the chances are more if you start preparing it earlier. Then now, the thing, the beauty of this UKMLA is it's not just the international medical graduates, even though the doctors, the MBBS students from UK also are supposed to give that. So now I'm going to do my MBBS preparation. So when I have to start the preparation for USMLE and all. So ideally, like from second year, like I suggest like from second year or third year, ideally. Can this be, sir, can these be exams cleared if you are a FMG examination? It's only about the mindset. Like, see, whether you are a foreign medical graduate or a doctor from India, from a government medical college or private medical college or from Central Institute. I trained from PGI Chandigarh Central Institutes, which is the cream of the country. But remember, it's all about the mindset. The one, see, if you know, the thing which determines that where you stand, like whether it's in a government or private college or like you sitting abroad, it's only like 2 to 3 questions or like maximum 10 questions which you determine. It's not. So I have seen people who are entering into the central institutes and going to the best of the best institutes from the FMGs. So don't even think about that. Like you have, you are seeing the world, you're exploring. So you can do this. Say PLAB examination. If you ask me, PLAB examination is or like UKML examination, which is upcoming, is much simpler examination than FMG examination. Mark my words on this. Okay.
Yes, sir, you're absolutely right. Actually, being a FMG myself, I cleared my FMG, did my internship, and also I cleared my PLAB one. And I have few of my friends from who are FMG, they cleared their USMLE Step 1 or AMC CAD. So I don't think it doesn't matter from where we studied. What it matters is how well we are ready to tackle the situation.
Correct.
What you said
Absolutely,
is
Shrimati.
right, sir.
Absolutely. It's all about in the mindset. Like we can see, if you ask me, even when compared with the NEET examination, FMG is much more tougher examination because I have been into training like for the last 10 years, the various examinations for NEET. I understand it is like they're more predictive examinations when compared with FMG. Like sometimes the paper will be so tough that the pass percentage will be 9 to 10%. And if you see this, and nowhere, if it is like, if in UK, if some times it happens to be 9 to 10% or 15-20%, the examination will be scrapped as simple as that. That means the paper is not as per the standards. So they follow certain guidelines. Okay. So, sir, any differences between FMG, plan, USMLE, AMC? See, the plan, I assume that it is PLAB, FMG, PLAB, USMLE, AMC. Can you see FMG? I'll tell you basically. Give me 1 second. See, what you do is FMG, PLAB, USMLE, AMC. Based on the number of examinations, one examination, one clinic, one MCQ, this is only MCQ, one MCQ plus one clinical, two MCQ examinations and one OET. Here also OET will be there. And here you have one MCQ examination, one clinical examination. Okay. And then here also at the end, like you might be OET. And the examination fee wise, close to 5,000. It will be around 25,000 plus 90K, around close to, comes up to 75, 80 plus 80. And it comes up to close to 1.3 and 2.5 lakhs. All subjects will be covered here in a single day. Here, mostly the aim will be for 5 subjects: medicine, surgery, obstetrics, pediatrics, and public health. Though all will be covered, but most importantly, these are the things. USMLE step 1, first year subjects. Second is medicine, surgery, gynaecology, pediatrics. And here, pathology is the most important subject, 50%. Medicine is most important with 50%. Then AMC, again, it has 2 things, 6 subjects: medicine, surgery, gynaecology, pediatrics, psychiatry, and public health. And here it is a clinical examination. The difficulty level, if you ask me, I'll tell you the difficulty levels. If I take FMG examination as 10 out of 10, I can grade PLAB 1 as 5 out of 10. PLAB 2 is 8 out of 10. USMLE step 1, because it is a pass or fail now, I can say it is 7 out of 10. Step 2, I can say 9 out of 10. AMC CAT 1, it is 7 out of 10. MC clinical, 8 out of 10. Now you can understand the difference profoundly. I still say, see, USMLE step 2, yes, it is difficult, but it is still predictable. Predictable in the sense like you go into the depth, you will get a clinical scenario and you will address this. Okay. I hope, Rohit, this answers your query. When USMLE examination can be taken, the step 1 you can take it. See, USMLE step 2 you can take it. Step 1 you can take it immediately after your second year, so that's the best time, and you can take it in before your 3rd year university examinations are there, or you can take in the early final years. You can take it. Second part 2 you can take during your internship. Regarding USMLE examination, I need to whole steps and how to give and when to give. Prem, I think probably you might have joined slightly late. So it is like predominantly 2 steps and OET examination, and how to give, you can give through online, and when to give, earlier the better at various stages. Just now explain. So can you give your past, hello sir, can you give your past question paper of FMG? They're all available. Past question papers of FMG, many are there, like which we can also share. Okay. From which year we should start preparing for UKMLE or USMLE? Whom we should follow for studies, suggest from free resources. See, always in the life, the most important thing is having a plan B. Even if you are preparing for USMLE, even doing some best of the things, situation takes 1 more year. So what is our plan B, whether UKMLE or Australia or FMG examination? If you are doing FMG, what is your plan B? Whether you have to do USMLE or UKMLE or Australia, first you decide like which you want to stay back, come back to India, or go abroad. When you're going abroad, always there should be a plan B. Even for India also, there should have a plan B. So plan B is very, very important. Earlier the better. I suggest like 2nd year to 3rd year is the best time. If you have class past that, like forget about like what happened, and now the earliest the better to start with this. Then And regarding follow-up, like we do, like why VSynapse is very unique is like, as the name says, mentoring the medical minds. We believe that doing is only 10%, guys. Doing is only 10%. Like suppose if you say, like, I'm just taking an example from Hyderabad. In Hyderabad, if you say like, if I say like go from, or like keep it, go from Hyderabad to Chennai, going to Hyderabad to Chennai is only like 10%. But knowing how to, the 90% is knowing the route, having the proper driver, and just planning, and the one who guides and mentors. That's what we believe in. Knowing is only 10%. Knowing how to do and what to do is 90%. That's what we are specialized in, and we handhold every student. We believe that every student is unique, their journey is unique, so the solution also has to be unique. So it differs. For every student, like we curate a special plans to go about. Then for UKMLA, how to do the preparation during the MBBS. As simple as that, attending the classes properly, getting your foundation strong, and doing multiple choice questions. And we organize like doubt clearing sessions, getting the concept strong. Then I'm a transfer student from Crimea now in Samara. Can I give UKML exam? I'm from Crimea. You can't give UKML PLAB examination. They mentioned in their websites basically about my previous university. For this, regarding this, I'll give you a much better answer. Like after going through the data and WDMS, like what is there in the website and all, I'll just go through that, and I'll be able to give the proper reason, because you have been transitioned, and whether that's going to meet the criteria and all. We have to, the easiest way is to write to the GMC and ask that. They'll give you an accurate answer that serves as a proof. Which app is good for USMLE, for preparing USMLE? Yeah, see, as simple as that, like we always say that UL is one thing like which you have mandatorily do the questions. There's no alternative for that. There are many question banks of that. UL is a very good, like has been curated, like that has to be mandatorily done. Okay. Any more questions? Sir, okay, 1 second, there's a question. One more question, I think. Okay, sir, and if I clear PLAB and come to India without clearing FMG, whether my degree is valid in India if I do PG in UK? See, yes, that's what I mean to say. If you clear PLAB or UKMLA and then you went on to do the residency, you became a medicine, and you done medicine, or you have done your cardiology and all, fine. You are a registered doctor in UK. But if you want to come back to practice in India, unfortunately, you have to have a medical licensing here in Australia. So even in that case, you should clear your FMG. But the good thing is, rather than being under the pressure of doing it now, suppose you enter into UK in 2025, and if you plan to come back in India in 2025, you have good 10 years time. You can come and write the examination, and you can still do that. You can, with 1 or 2 attempts, you can clear this examination. So that's what you can do this. Then. Then resources for clearing FMG, there are umpteen resources, but only thing is selecting like which resource you have to use, and that can do that. How much it must cost per complete? I'll explain the plans. If I pass the USMLE step 1, then no need to give the next examination, as I heard from some seniors. No. Next examination has to be given. Like so unfortunately, wrong information has been given. If you study abroad MBBS, after completion of MBBS, we come to India without any examination. Unfortunately, no doubt we have to do that. Best subscription for next examination. Once it comes out, like we'll do that. There are many resources. So is USMLE compulsory after MBBS? See, USMLE is mandatory. Like if you want to enter into US, even if you are a super specialist in India, still you have to do that. Now, regarding the plans, what we do is we do a specialized training for USMLE one-to-one training, and where we do not only the training, mentorship, one-to-one sessions, and less than 5 group sessions. Group of 5 sessions, and then materials, mock exams. Most important thing is complete doubt clearing sessions will be there, which will do that. Similarly for UKMLA or PLAB and for AMC. So most important, in addition to all these things, many students after clearing all these things, they stumble with the portfolio. We do an immediate portfolio building, like hand-holding you, like research paper presentation, publication, leadership roles, training experience, teaching experience. That will make it a super good portfolio. This is all what we do at recent apps. And you can reach out to us more regarding what are the resources and what are the financials and all, any more doubts, you can reach out to us and we'll send you the feedback form. Just fill in this, and you have any further more questions, you can reach out to our team, guys. Any more questions? How much it costs for complete UKMLE journey? I assume it is UKMLE. If it is other than the examination fees, as I explained, other than that, like if you want to say UK or USMLE, somewhere between close to for training, materials, mock exams, leadership roles, portfolio, and all these things, like somewhere between 9 to 15 lakhs is something which we can assume so. And then thank you so much for saying all our doubts. Like pleasure is ours. See, first of all, like before ending the session, I just want to say one thing. It's only the mindset that determines where you want to go, what you want to achieve, whether you want to win and how big you want to win. You are one thing. If you think that you are no way inferior to the others who make it here, you can. It's just. I have seen people who took a large plunge and enter into the central institutions and going into the best of the best universities and in Mayo. It's all about the mindset, guys. Stay focused, stick to the basics, do the multiple choice questions, come out of the comfort zone, success is yours. Okay. And here we are all there to help you out, and the team study pals team is with you, like who are keen to help you. They're not shedding away their responsibility, saying that like we are done with this. They're taking that extra little step to help you out. And yes, we know how to handle and how best we can handle each individual student to ensure that the dreams turn into reality. Okay, guys. So all the very best. Thanks for joining, and have a great day. Thank you, Dr. Srimati.
Thank you so much, sir. It was a great pleasure, sir. It was a very informative webinar, actually, sir.
Yeah, thank you. Thanks a lot, Dr. Srimati. And any more questions, you can reach out to us. I'm just dropping down like